Brucey, how you doing? Do you need dental cleaning? Oh, poor thing. Yes, you do.
Yeah, so truth be told, I'm actually a little nervous to take him in tomorrow for his dental cleaning. He's not just going to get his teeth cleaned, he's going to get a few extractions. I'm not quite sure how many until they go in and they take a look at what needs to be done. I have the hardest time cleaning his teeth, so I do brush his teeth, but his mouth is just so small that it's really, really difficult to brush his teeth sometimes. So he's going in tomorrow and I'm just trying to rush around and get ready for his surgery. I'm a little nervous, truth be told, because he's really small. He's only 2.5 pounds. He's actually less than 2.5 pounds right now, and he's not a young dog. He's 8, which isn't extremely old for a Chihuahua, but he's not, you know, like a puppy anymore. And so I am concerned about, you know, the risks involved. I'm worried, I won't lie. Yeah. Because I don't know how many teeth he may have extracted tomorrow, I've got to figure out what type of food I need to have on hand tomorrow. I have this already. I'm not in any way endorsing these brands. I'm just showing you what I have on hand. So he tends to like this beef with broth, and I do have a leftover syringe which will come in handy if he's not eating and I need to kind of force feed is the wrong word, but I need to feed him with the syringe. I hope I don't have to. And I do have some soft food on hand. I don't usually use soft food with my dogs. I need to go grab him some other stuff in the event that he doesn't eat this. Who did this? Believe it or not, my dog loves salad, so a sure way to get him to eat something is give him some salad. It's weird, right? I know. So my concern right now is not so much the nutrients in the food I'm getting my dog, but I just want to make sure he eats something after his surgery. So I'm going to go get him some pizza because he loves pizza, and I can cut it up into really small pieces and he's going to eat that for sure. So yeah. If all else fails, I'll give him some grilled chicken breast or grilled salmon. I'll just blend it up and hopefully he will eat that. The one thing I was not able to get for my dog was I broke the collar that he doesn't wear a collar around the house because he's just so small and he doesn't need it. But I had a hard time previously finding him a collar that would fit because his neck is so small. I broke the plastic clasp, so when I take him in tomorrow, I only have his leash, so they're gonna either have to, which I'm gonna request that they put a pee pad in his kennel. I'll take him with his leash, but they're just gonna have to, you know, do that fancy little wraparound loose knot because I don't have a collar for him. That's one thing I do have to remember to get for him. I forgot that there's certain things I have to do or not do before he goes in for surgery. I almost forgot. It's almost 8 o'clock, so they gave me a list. Would you like to read with me? They gave me a list of stuff that I have to do, like the day before surgery, no food after 8 p.m. Regular meals, but remove food by 8 p.m. You haven't eaten dinner yet. It's almost 8 o'clock. I gotta feed you. Hey, hi. Ew, yuck. That's gross. That's gross, Brucey. Hi. I love you. Did I mention that Bruce is like super fussy? And I need to make sure he eats a lot tonight. So, this is a chicken breast. Also going to add a bit of water to it just to make it a little bit easier to go down because chicken breast can be kind of dry. There, so that's what it looks like. I will do another video on what I normally feed my dog, but this has got a lot of protein and it's heavy and hopefully it will hold him through until tomorrow night when he's going to get his dinner. Okay, go eat.
Come, here. Here, honey. Eat. Chicken is nice, right? You gotta eat, because I gotta take this food away from you. Come on. I know you're probably wondering why is Bruce's like little ding dong hanging out. Yeah, I'll talk about that in another video. He's fine. Don't worry, he's fine. Come on. This is not playtime. Come on, come eat. Hello. Oh, you. And as I suspected, he's not going to eat his dinner, so I have to put some stuff on top of it to hopefully try and entice him into eating. Normally it wouldn't be an issue because I would just leave it out and he'll eventually come and eat it, but I have to make sure he's eaten by 8 o'clock, which is in a few minutes. Brucey, you want this? Look! Come! This dog is so spoiled. Hi, look what I got! Oh my goodness, look! Look at these sweet peppers and zucchinis. You love this stuff. The vet put Bruce on antibiotics because when I took him in for his pre-operative checkup, I guess you call it, he does have a bit of a sneeze, and I really think it's because his teeth are just not so good. I think it's just kind of infected and he needs helps. He doesn't like this. The dosage calls for 0.25 mils or cc's, which is really small. And it's very hard to tell. Hi, honey. Can you smell that I had pizza for dinner? It's really hard to tell if I have enough in this dropper because you get like air bubbles in here and you can't always tell if you've got the right dosage or not. Okay, I think I have the right dosage. Betty? He doesn't like this. Come on. You just put it in the side of the mouth. Here. Good boy. Ew, yucky, gross, right? I know. Here, have a little more. There we go. And to make sure I'm getting all of it. There. A little bit more. Okay, ready? Good boy. And that's that. Hi guys, well it's the morning of Bruce's dental surgery and I've got to get him out of the house now. Hey. Let's go, are you warm? Here, yourself up. There. Okay, Bruce. Okay, okay. There you go. So his bye, Brucey. See ya. I'll be back soon. I'll be back. Bye. Poor Bruce. He was okay, fine, while we were driving there, and then we parked, and he realized that he was at the vet's, and then he started to not be so happy. Now I just have to wait. So apparently the surgery will be this morning, and they'll call me as soon as it's done to let me know how it went. And they'll monitor him. So the normal time for pickup is about 4 o'clock-ish, 4:30. Of course, depending on how well he does after the surgery. Guess what? I got great news. Bruce is out of his dental surgery and he did just fine. So I'm really happy about that. And I am just waiting. I look at my wrist like I have a watch there. I'm so used to having a watch. I don't. 5 more minutes and I can go grab him. So I went to the dollar store and I picked him up this real girly mauve colored fleece. It's not cold here, but you know, I want to make sure he's warm because he just came out of surgery. So I'll wrap him in this and he can ride home in this, and then yeah, we'll get him home. Apparently he can only have a little bit to eat tonight, just in case he throws it back up, and I need to keep him on his antibiotics just to make sure, obviously, that he doesn't get an infection after the fact. I missed him. I can't wait to see him. My poor thing. Oh, I feel so bad for him that he had to have some teeth extracted. Hey, look who I got. You look better than I thought you would be feeling. Oh, hi. Okay. Hi. Oh. Well, I'm gonna get this guy home and I'm gonna put him to bed. Poor thing. Okay, Boosie. Alright. Okay, guys, thanks very much for watching and we'll see you next time. Okay, bye, Boosie. Okay. Alright, bye, guys.